I hope you have heard this particular condition called motor neuron disease. You know, the famous scientist Stephen Hawking was afflicted with this condition called motor neuron disease. He had this condition from the age of 20s and he survived up to the age of 60. That is a miracle in the medical history, because most people would die within 3 to 5 years. Only 10% survived 10 years. So he survived nearly 40 years, probably he could utilize all the amenities, or this may be a different form or a different spectrum of motor neuron disease. What is motor neuron disease? You know that your whole brain is studded with new neurons, or your initiator cells. There are so many neurons are there for the motor, sensory, everything is being originated in a neurons. For the motor part, suppose if I move this hand, what's happening, there is a motor neurons, there is a motor neuron pull from the spinal cord, which is destined to the upper limb or the hand. If those are lost, or if these neurons are disintegrated or damaged on its own or degenerated, is called what is called a motor neuron disease. This may be due to differing causes, but the prototype of the condition called amyotrophic lateral sclerosis, where there is a problem in the neurons or the cells in the spinal cord, in the brain or in the brain stem, plus other systems are also affected. Usually they present with weakness, wasting or thinning of the limbs, some tremor or fasciculation, or the muscle would ripple in various parts, and this gradually progress over a period of weeks or months or years, maybe a few years, and they would finally within 3 to 5 years they would succumb. That is the sad part of the motor neuron disease. You know that 10% can run in families, so inherited, so with some mutations, superoxide dismutase, and many such mutations are there. The incidence of this condition is around 2 per lakh, and the prevalence, the amount of disease in the community is around 6 per lakh. That means there is a good number of people are there in every part of the world. The usual age of onset is 40 to 70s. Hardly it occurs in young people, but I have seen people with 25 with motor neuron disease in their 20s, 30s and 40s. So it is not that uncommon. But what are the various risk factors? It's been said that smoking, head trauma, sports, contact sports, electrocution, radiation, these are our family issues, are some of the risk factors for this condition. And there are many types are there. The motor neuron disease may be purely affecting just weakness and wasting only, or those with some other areas, some other parts of the brain is getting affected, where there is a stiffness, spasticity, difficulty in walking and all. So the combination can be what we would call it as a upper motor and a lower motor, or a combination. It can be different spectrum from one end to the other end. So what are the various features? They would come with the weakness, difficulty in using their hands, weakness and wasting or thinning of the limbs, maybe hands, forearms, arms, the trunk, the limbs, the thighs, the legs, and many areas. The bulbar area or the tongue will be weak, the palate will be weak, the swallowing will be abnormal. So they would come with the differing manifestations. Sometimes they can come with a drop head, sometimes they come with a difficulty in speaking, difficulty in swallowing, aspiration. Whenever they take some food, they tend to aspirate. They will have some emotional incontinence or pseudobulbar affect. They would laugh or cry most often without any valid reason, and they'll be having weakness of the hand. They won't be able to use their hands, and this gradually progress over a period of months, and most of them, or at least many of them, would die within 3 to 5 years. Hardly ever they cross 10 years. Okay, as I mentioned, Stephen Hawking, he could survive 40 years with this condition. So as I mentioned, they can come with weakness of both hands, both legs, or one side of the body, or they come with what you call respiration, difficulty in respiration, difficulty in keeping the head erect, difficulty in swallowing, or differing manifestation, or on both sides. Okay, so differing manifestations are there. So what are the things that you should consider, or what you should exclude when you find this condition? There are many conditions called various endocrine abnormality, hyperthyroidism, hyperparathyroidism, various cancers, lymphomas, insulinomas, paraproteinemias, myelomas, and some heavy metal poisoning, lead and mercury. Okay. All right. So what are the various investigations? So you know that we have to. There are certain conditions: hexosaminidase deficiency, polyglucosan disease, hepatic myelopathy, B12 deficiency, vitamin E deficiency, vitamin C deficiency. Many such conditions can also, they might cause. It is not that they are 1:1 relationship. And copper myelopathy, deficiency of copper, deficiency of phosphate, various inflammatory neuropathy, CIDP, multifocal motor neuropathy, many such conditions are there which should come in the differential diagnosis of motor neuron disease. So how will you approach this patient, or what are the treatment options? The options are very much limited. The one drug which is approved is Riluzole. You can use it and it would increase the survival by 3 to 5 months. The other drug which is used is Edaravone. Of course, we can use vitamin E, vitamin C, methylcobalamin, and correction of any metabolic toxic electrolyte disturbance. Heavy metals, if they are exposed to, you should see that the mercury level and the lead and other arsenic and all other heavy metals, you should be careful. Then other treatment would be mainly supportive therapy, physiotherapy, stretching, giving for if there is spasticity or stiffness, you can use baclofen or tizanidine. If there is difficulty in speaking, you can take the help of a speech therapist. And if there is a drooling of saliva, can use various medication like a glycopyrrolate or local botulinum toxin injection to the salivary gland. And if they can't swallow, of course we can give them in a semi-liquid or semi-solid state and give by spoon, and you can keep it slightly into the mouth. You can use a rice tube or a enteral tube, or if they can't, it's not if they don't agree to that, you can always use a peg. You can put a small hole into the stomach and can feed through that. It's called a percutaneous endoscopic gastrostomy. That can be done. Then we can always give them continuous physiotherapy, stretching, and other medications. You should have a team-based approach. This should include a neurologist and physiatrist, physician, occupational therapist, and various different orthotist and psychotherapist, and various other. All the groups should be involved. The nurse should be involved. The counselor should be involved. The psychologist should be involved, and we should try to help them. And you should always have a discussion with the caregiver or the family members, because you know that it's a relentlessly progressive condition. This would hardly ever I saw any patient who have crossed 10 years. Most of them would die within 5 to 6 years. So the nutrition, you should ensure that he should get adequate hydration, water, electrolytes, protein, everything should be in correct proportion. They should have a good optimistic outlook, good physiotherapy, exposed to sunlight, all the nutritional replenishment should be there. And at some point of time they would be bed bound or they would be confined to a wheelchair. In that case, you should assist them by giving a proper wheelchair, and in the meantime, before landing up into the wheelchair, they should give sufficient support at home using bars. This supporting structure should be there in the bathroom as well as in the other areas. The flooring should be clean, and the lighting should be there, and they shouldn't fall, because it's they tend to fall more often. And they should have all the support or the facilities at home. Physiotherapy, I think if the physiotherapy or the physiatrist or someone who cares the patient, they should visit their home and see what are the modifications to be made at home. Secondly, if there is a difficulty in communication, we can ask them to write what's the problem, what really matters at that point of time. And you should always use a communication board where you can write everything that I have pain here, I want to pass motion, or I want to speak, I want to think, many things. So you can always write a 10, 20 with the pictures. It's called a communication board. They can use a phone with a smartphone, and they can have a voice synthesizer. And at some point of time, if they can't do that, also you can try to identify with the gaze and eyes, looking there, looking up, looking down. So in that way also you can communicate with them effectively. And of course we should discuss beforehand what's their final wish, and whether they want any tracheostomy or ventilation or some, because you know that once they are into the ventilator, it's hardly is possible to bring them out. So it's a event on its own. So I think I could give you some idea on motor neuron disease, the various ideas, or this thing that you have to think and do in motor neuron disease. If you have got any queries or comments, you can always do that. Thank you very much.